Hello, good evening. Today we are going to discuss the case note of Mrs. Pamela VIDUKA. Uh, this letter is a referral letter to Miss Maxine Mullins, whose position is a district nurse, and she is responsible for providing Mrs. VIDUKA the follow-up care in this case. So you are going to refer the patient to the district nurse who is responsible for providing follow-up care. Okay, so in order to give follow-up care, we need to let her know some of the information, and those things should be outlined in this letter. That's all we need. We don't have any specific requirements. The prerequisites for follow-up care should be outlined in this letter. Let us go to the letter in detail. Mrs. Pamela VIDUKA is a 72-year-old patient in your case. So she is ready for discharge. She has just undergone a mitral valve replacement. So the patient's name is Pamela VIDUKA, 72 years. She's in her old age. Now, she has undergone a surgical procedure, that's mitral valve replacement, because she had valvular heart disease. So that's mitral valve prolapse. Now, these things, we have got the information here. Now, the reason for admission is clear there. Now, I have the social history, lives with daughter. And smokers for 55 years. So that's something important there. Now, she has a medical history, chronic bronchitis, hypertension, chest infection since retirement 12 years ago. So medical history, we have 3 relevant medical history there. Now, she was admitted on 18 and she had a valve replacement procedure done on the same day. And she was put on antibiotic and anticoagulant and analgesic therapy, including anticoagulant therapy, was done with warfarin. Now, what we have here, 1920. Now we have to progress through, recovered from analgesia. Now, 21. Something is relevant here regarding quit smoking programs and using of patches. So we have given information how to use patches, and we have given advice regarding smoking cessation. And the patient was seen by a dietitian and he recommended her low salt diet. That's another important thing here. Now in 21, you can see general recovery. It's well, good. And now independently she can shower and dress. But still she uses a walking stick or walking frame, ready to get discharged on 24 of November 2008. So at present she has no other difficulty except walking, mobilization. Rest everything is clear. No further complaints, but she needs rest. And the service of the district nurse is requested here in order to arrange home visits for Mrs. VIDUKA in order to monitor her medication complaints, whether she is taking adequate rest or not, regular follow-up examination, international normalized ratio, auscultatory assessment of heart because she has the problem here. Now, something very important here, which is given, is avoid invasive surgical or diagnostic procedure until prophylactic antibiotics are given. So this is to be highlighted in the paragraph there, which we are going to write at the last. Now, we have some current medication that has to be very included, and that is very important here because we are going to give write a letter to the district nurse who is supposed to give follow-up care. So we need to give this information very importantly. So that's warfarin, salpeterol, and Mirax, including the dosage we are going to give there. It's very important there. Now, its letter is not so complicated here. Let's go ahead with the discharge date. That is 24 November 2008. Max Mullins. Address is clearly given. Dear Miss Mullins, reference Miss PAMELA VIDUKA, aged 72. Up to this is very clear. Date, address, salutation, reference. This letter is to request follow-up care for Mrs. PAMELA VIDUKA, who has recent undergone, who has, I have to edit here, who has recently undergone a mitral valve replacement surgery. So that's the correct tense that we have to use because she had the surgery and he's recovering from the surgery. She has the effects of the surgery still. That's why we have used the tense here, who has recently undergone a mitral valve replacement surgery, instead of using she underwent a mitral valve replacement surgery. If we want to use she underwent a mitral valve replacement surgery, the surgery is done long ago, and we don't have anything to do with the aftercare of the surgery. Still, we have the surgical complications. At least some minute things are there because she's still on an anticoagulant therapy, and she has to be monitored regarding some of the heart auscultation, all these things. So that's the reason why we have used has undergone a mitral valve replacement surgery. Now, you can write the social history on the top if you want, no problem there, because we are not going to highlight any or we are not going to pressurize anything which has to be highlighted. So we are just giving background information of Mrs. VIDUKA. Either you can go with the social history first, no problem there. So I would present in this way because the surgery was recent. So the present history, Mrs. VIDUKA was admitted on 18th of this month with complaints of chest pain, lightheadedness, and fainting. It's always good to change the style of writing. I recommend it should be somewhat different from the case note. So admission date was given 18/11/2008. So if you go like this, there will be some sorts of changes, the rephrasement of the sentences. That's good for scoring good marks. Now, Mrs. VIDUKA was admitted on 18th of this month with complaints of chest pain, lightheadedness, and fainting. So these were the complaints Mrs. VIDUKA had at the time of admission. After being diagnosed with mitral prolapse, the aforementioned surgery was performed and she was treated conservatively with antibiotics, analgesics, anticoagulants, and warfarin. So I can cancel off this warfarin there because I have written warfarin another way because warfarin is an anticoagulant. So it would be a repetition there. So she was treated conservatively with antibiotics, analgesics, and anticoagulants. So we have the connective here. After being diagnosed with mitral prolapse, the aforementioned surgery was performed and she was treated. Here I need a comma. And she was treated conservatively with antibiotics, analgesics, and anticoagulants. On the subsequent days, she was encouraged to stop smoking and was given advices to use patches. So I can write post-operatively. Instead, I prefer to write on the subsequent days because we have a duration written there 19, 20, 21 or something like that. So subsequent days, and we are briefing these things. We are not going to write everything. So we are briefing these things. So in order to brief, we have to use the phrase on the subsequent days. She was encouraged to stop smoking and was given advice to use patches. In addition, she was seen by a dietitian who recommended low salt diet for her. That's clear. Now, what all things we have given is the first thing is the conservative therapy. The second thing is smoking cessation programs and advices of using patches. Next is the dietitian review. And now the condition of her, she can shower, groom independently, but still she uses a walking frame. So the paragraph is well connected and it ended with the present situation of the patient. Now let's go with the past medical history and social history and past medical history here. Mrs. VIDUKA lives with her daughter and has a history of chronic bronchitis, hypertension, and chest infections. Her current medications including warfarin and daily doses of salpeterol 3% Virax 25 mg. Now I have to make some corrections here. The thing is that she lives with her daughter and has a history of lives with her daughter and has a history of and has a long history of smoking. And this is what I have to say. She is a known case of chronic bronchitis, hypertension, and frequent chest infections. Now I have to detach this particular thing here. I'm going to fix it somewhere. At the last, I have given it. Okay. Now, the social medical history. Miss VIDUKA lives with her daughter if you want to add she's a widow, you can say that, no problem. The Viduka lives with her daughter and has a long history of smoking. She is a known case of chronic bronchitis, hypertension, and frequent chest. We don't need to say the chest infection. She has been suffering from chest infection since retirement. No, we don't need to give that much details. We just need to brief it. That's what we have done. Now, the last paragraph is the discharge plan. It's the content there. It would be appreciated if you could arrange home visits for Mrs. Viduka to monitor her medication complaints. And international normalized ratio. Apart from that, kindly conduct. So in addition of monitoring her medication complaints and international normalized ratio, kindly conduct heart auscultation, regular follow-up, or I need a comma here, regular follow-up examinations, that's formal, and ensure adequate rest for her. It's pivotal to avoid any invasive surgical or diagnostic procedures until prophylactic antibiotics are given. Of note, her current medications include warfarin and daily doses of salpeterol 3 puffs and Mirax 25 mg. Or I can say current medications include warfarin, salpeterol 3 puffs, and Mirax 25 mg once daily or once a day. Another way, we can say in either way. Now, in case of any further queries regarding Mrs. Viduka's condition, please do not hesitate to contact me. Now, he's a known person, so we have written yours sincerely. So that is the end of the explanation here. We discussing in the letter soon. Till then, bye. See you.